We're diving into another important topic in immunohistochemistry, the pituitary adenoma panel test. This test is crucial for diagnosing and classifying pituitary adenomas based on their hormone content and reactivity patterns. So, let's get started. Pre-test information. Before undergoing the pituitary adenoma panel test, there are a few important steps to follow. First, you'll need to provide a copy of the histopathology report. This report gives a detailed description of the tissue sample and its microscopic characteristics. Provide a copy of the histopathology report. Next, you should have information on the site of biopsy. Knowing exactly where the tissue was taken from helps pathologists make a more accurate diagnosis. Site of biopsy. Lastly, providing a clinical history is essential. This includes any symptoms, medical history, and relevant clinical findings. It helps in correlating the test results with the patient's overall health condition. Provide clinical history. Specification of the test. The pituitary adenoma panel test is specifically designed to classify pituitary adenomas according to their hormone content. This is important because different types of adenomas may produce different hormones and therefore require different treatment approaches. Diseases associated. Pituitary adenomas are typically benign tumors that arise from the pituitary gland. Despite being benign, they can cause a range of problems due to hormone overproduction or because of their size and location, which might affect surrounding structures in the brain. Diseases associated. Pituitary adenomas. Benign tumors of the pituitary gland. Specimen used. The specimen used for this test is a biopsy from the pituitary gland. The biopsy sample is carefully analyzed to determine the type of cells present and their reactivity to different antibodies. Components included in the test. This panel test includes several critical components. *AST, used to identify corticotroph adenomas. *FSH, follicle-stimulating hormone, for detecting gonadotroph adenomas. *G8, growth hormone, important for identifying somatotroph adenomas. *Ki67, a marker used to determine the proliferation rate of the tumor cells. *LH, luteinizing hormone, also used for gonadotroph adenomas. *LMWCK, low molecular weight cytokeratin, helps in distinguishing different adenomas. *P53, a tumor suppressor protein that can indicate the presence of aggressive adenomas. *Prolactin, commonly associated with lactotroph adenomas. *Reticulin, assesses the architecture of the tumor. *TSH, thyroid-stimulating hormone, used for identifying thyrotroph adenomas. Test report time. After the biopsy sample is submitted, the test report will be available within 7 days. This time frame allows for a thorough analysis of the sample, ensuring the most accurate diagnosis. Test report time. 7 days. General test information. Pituitary adenomas are currently classified based on their content of specific hormones. This is where the pituitary adenoma panel test plays a vital role. These tumors exhibit distinctive patterns of reactivity with antibodies to transcription factors and cytokeratins. It's interesting to note that more than 90% of adenomas contain CK8, a type of cytokeratin. 90% of adenomas contain CK8. Understanding these patterns helps pathologists determine the exact type of adenoma, which is crucial for deciding the best course of treatment.